I'll tell you what you should avoid doing when you have neck pain and what you can do to relieve it. Stay right here. But before we start the exercise now, first take a quick look at this. Everything looks so beautifully free, as if everything is relaxed because there are no muscles there. But you have to imagine there are thick bundles along the spine, then thick bundles down here in multiple layers. And often the posture, because we often sit at a desk and don't balance it out, is not the best. That means the neck is overextended, then it becomes tighter and tighter. And then we have to address this block to make some changes. And now imagine Ina has such a lump, highly sensitive. And most people then say, oh, I have to be careful. Sometimes it is further aggravated by certain aids. And I would recommend resting only as much as absolutely necessary. And if you can bring a little flexibility in, always try that. And now we are also trying very, very carefully. We imagine Ina has a real problem. She can hardly move her neck. We will still do the exercises now, but very, very gently. Ina, let's get started. Turn your head very, very carefully as far as it can go. It may be that you can hardly turn it, but maybe a little bit will work. Normally we would rotate to 45 degrees. If it's only about 10 degrees, then just turn it to 10 degrees. Leave it like that. Pull your left elbow down so that the shoulder comes down, and now reach very, very carefully for your head and be really careful. Do not make big, hectic movements, especially not with these exercises, but gently test how it feels when you pull your head towards your right knee. And then you do that for a while, maybe half a minute, maybe a minute. Normally we always practice for 2 minutes, but if it is already so acute and with the slightest movement anything can happen in terms of pain, then you just do it for a little shorter time. The main thing is that it moves at all. And then you go out again and do the same very, very slowly on the other side. Move a little to the right and then go down again with the right elbow and right shoulder. Go over with the left hand and carefully test how much can still move there at all. And then you breathe in slowly, breathe out slowly. So you actually do this exercise just like usual, only much, much more restrained. Exactly according to the intensity that is triggered. Basically, one wouldn't even need to talk about it if the 2 rules are followed. Move very slowly and only in a way that is just bearable. And in such highly acute neck situations, a little bit is just about tolerable. So don't overdo it. Breathing is always a calming factor, also for the muscles, and therefore always nice and deep in and nice and deep out. And when exhaling, you automatically notice that a little more can happen. And then you come out again and test a little bit very slowly. And then it could be that just through this small effort on each side, a small attempt, the whole thing has already become a bit more flexible. And then you stay with the same exercise, and during the next attempt you notice, oh, now I can move a bit more instead of just this small 10-degree angle. Go into this angle, do the same thing again. Bend left elbow again. So it's best to keep the elbow in the direction where the knee is. Also like this, diagonally, slanting forward, and then you pull in there. And maybe now a little more is possible. And you stay longer, feeling a bit more confident. Always make sure that the shoulder stays pulled down nicely, that the back stays nice and straight. Breathe in deeply and take your time. Time is especially important in these highly painful conditions. It is once again an important factor to really distribute the intensity over a longer period of time so that the tissue can get used to it. That is all. What is so incredibly tense there must be slowly removed, and that just takes time. And then you slowly come out again and test a little bit and maybe notice, oh, it's already a bit easier. And this is a very, very important effect, because when you notice that it becomes easier, it gives you a feeling of improvement. And the good feeling, that is as important as the exercise itself, because this good feeling also helps to relax a little bit, because you lose your tension, you lose your fear. You notice, oh, it's not as bad as it used to be. Maybe it's gone from 100% to 90 to 85. And you notice, man, something is really happening. And this is such a positive spiral that is set in motion by this. We are now doing the same on the other side. Exactly. Maybe it's already going a little further, always as far as possible, until it starts to pull, and then you reach over again, always the same process. The shoulder must be down, the back must be straight, and then you pull the head 45 degrees plus or minus forward to the left, down, breathe in again, and really take your time. Yes, no rush, especially with such acute issues, no rush. And you notice millimeter by millimeter how the head can go further into the stretch. And if you then think to yourself, oh, I could use a little more, then you pull your chin towards your larynx. Pull your chin towards your larynx, just as if you wanted to straighten your cervical spine, exactly, and then it will become even clearer. And then you slowly come out again, and maybe now you realize, okay, with the exercise, that's enough for now. By the way, since almost everyone has problems with the neck, it would be great if you would recommend the video, share it, or show the exercise to someone who is struggling with these issues. And now feel inside and perceive what has changed. And there is a good chance that something has really changed, which also makes you feel more secure. Therefore, we are now moving on to the next exercise. You stay sitting up straight again, back completely straight, and now raise both arms up and grab the upper back of your head, keeping the elbows relatively close to the front. This is a good starting position, and now you carefully move the head forward in such a way that the chin comes closer and closer to the larynx, and then you probably already notice that it is pulling back there. And then the process is exactly the same again. You must still feel just as good and continue very slowly and keep breathing in deeper and deeper. Millimeter by millimeter, you notice how it loosens up back there, and you keep going forward gradually, avoiding sudden movements, breathing deeply in or out. And make sure that the back does not curve, but that practically only the head moves forward from the shoulder girdle. Only the cervical spine and the thoracic spine remain completely straight. Conquer millimeter by millimeter, so to speak. And you do this for 2.5 minutes, and then slowly come out again, slowly come out again. And now it's always good to actively move along what you have already practiced a little bit. So, you would start again, gently turning your head as far as it goes, and then with your temple towards your right knee, no, practically using the temple for the movement, just like we did with the exercise. And then you would come up again, straighten your head, tilt a little to the right, then the left side of the temple towards the left knee, and come up again, and then bring your head forward, roll up, and come up again. And it may well be that you automatically also have the need, oh, now I was leaning forward to the other side, leaning forward straight ahead, and now what about the back? But now you have to be very careful, because this is already a direction that most people are not used to. You have to approach it very carefully. And with such acute neck pain, there might be even more resistance. So it's best to start with just active movements first. Bring your chin back and your forehead along with it, and then gently go into that overextension. A little bit in, stop, probably already too much, and then you stay there for a moment, yes, just a very small movement, and go in a little bit more. And then slowly raise the chin more and more, lift the chin a little. By the way, we now have a newsletter, a WhatsApp newsletter. If you are interested, please click there. And you do not let yourself be deterred, nevertheless always stretching your head further back. Yes, so very slowly, and now maybe, when you've become a bit more confident, take your right index finger to your forehead and provide a bit of support. Always trying to get a little more space. And then slowly back, also let go. Now bend forward and try to get the general mobility back into your system. Then back again, yes, this change from back to front so that the muscles get used to it. That is the movement that we are actually allowed to do. Then turn a little to the left again and go back down to the front with the temple always as if we were doing the exercise exactly. Then maybe also play a little there in the opposite direction, backwards and up to the right. That would now be the other direction, then straight again, and once again to the right with the head. With the left temple towards the left knee, and then come up again, then a little backwards, come up to the top right, and straight again, and feel in. Just tune in, relax a bit, gain confidence, and if you have a very acute problem, you can do this every 2 to 3 hours as you feel the system can handle it again. Any more questions?
That was very good because that is a weak spot for me.
Oh, you too? All right.
Yeah, that was great, and that's how I will ease into it because I think I always overdo it a little.
Okay. You must not do that with a highly acute neck problem, so exaggerating is not great anyway, but in such a situation, it's even less appropriate, so be even more cautious then.
Feels very good now.
Okay, very good. And if you want to do even more for your neck, you have to remember that a neck that is so tense, the metabolism is also pretty low, which means everything is stagnant and hanging. And a fascia roll massage is once again a real relief and can also help to get the metabolism rolling again, so to speak. And to do this, you best take a mini roller or a comparable roller. A rolling pin with something soft around it could also work for the beginning. You practically turn your head to the left, go into this stretch that we just practiced, place it like that, and then grab the mini roller with both hands and start where your bone is behind the ear. There is a bone that you can feel, and there you can practically start and then roll with the foam roller in a diagonal direction, always further down towards the shoulder blade, just like Ina is doing right now. I don't know if you have something at hand with which you can roll, otherwise just take a look and try to imitate afterwards. And then you notice as you go further down, you increasingly reach a point where it becomes harder to move the roller. And when you notice you have practically reached the shoulder girdle, so lower neck, then you stop and do the same thing again on the other side. And then I have one more tip for you for the lazy people to do. Look, that's what I mean, stretching the neck nicely while resting on the neck hero. If you don't have it yet, then you just have to stack 2 or 3 books on top of each other so that you are lying straight with the edge of your skull, and then simply let your neck stretch further and further in a relaxed manner. Lying on that feels totally great for most people. Try it out. I think you will be pleased. In the description, you will get information about it. If you feel like doing more exercises, then click here for tension headaches. Otherwise, you can subscribe to my channel there. If you haven't done it yet, it's high time, and don't forget to activate the bell. Goodbye until next time.